So if you're pre-diabetic, you have a chance for becoming diabetes.
Diabetes is the increase of sugar in your blood, which is not reaching to the target organ.
There are a lot of myths regarding diabetes.
On the eve of this World Diabetes Month, November, I think it is worthwhile we have a discussion about the myths and facts about diabetes. Maybe that is what is most concerning now, right? So George, let us start the facts of diabetes so that we can discuss about both facts and myths. What do you think, George?
Yeah, so thank you for that question. So when you talk about diabetes, in the common man's terms, it is basically increased sugar in the blood. This is how the common man relates to diabetes.
True.
But as a physician, as doctors, we tend to dwell more into the subject. So what we have to realize that it's basically an imbalance between the sugar and the insulin in the body.
Exactly.
So when we talk about insulin, it is basically the hormone that regulates the blood sugar in the body. So we have two aspects to this. One, in which there is deficiency of insulin in the body, and two, when there is a resistance to the end organs, the way they react to the insulin. So likewise, we have got two main types of diabetes, the type 1 diabetes and the type 2 diabetes. Type 1 is where there is basically a burnout, there is lack of insulin, lack of beta cells. And type 2 is one entity where there is insulin, but gradually the end organs, they become resistant to insulin.
So that means we are talking about insulin resistance.
Exactly.
The term resistance, which was not heard to people, but nowadays people are much more aware about insulin resistance. And George, you are correctly mentioning the term that insulin resistance, which is actually now patients come and ask us about insulin resistance. Eric?
Yeah, exactly. So this is the basic facts of insulin, of diabetes mellitus. But now we see that they've got a lot of online, access. So people come with a lot of questions to us. There are a lot of myths regarding diabetes. So Dr. Naufal, can you just share some myths regarding diabetes and how we can tackle them?
Some of the patients while coming to the OPD most of the patients may be asymptomatic. There will be no symptoms for them. But while testing the blood sugar and all, it will be high, like about 250 or 300 like that. But still some patients believe that they don't have diabetes. There is nothing like that. Because he is asymptomatic, he can control with food alone or something like that. And he may not listen to us also. Some of the patients.
Very good. Raj, do you have a similar experience?
Yeah, I want to add something. First, they don't have a clear concept about the diabetes. Like, I just want to explain this Dr. George's part in very simple terms. Like, what is diabetes? Diabetes is the increase of sugar in your blood. Increase of sugar in your blood, which is not reaching to the target organ.
Yeah. Perfect.
So, when there is lots of sugar in your blood, actually if we keep something in the sugar, anything outside, that will get damaged very easily. So people should understand that lots of sugar in the blood per se will damage the organs.
Even if there is no symptoms.
Even if there is no symptoms.
So talking about symptoms,
yes.
Is there any symptom that you can actually catch hold of a person like you are diabetic? Is there any early symptoms before the actual onset of diabetes per se? We have anything to add on that?
Sick. Lots of time I get a patient with a non-healing ulcer, and this is, I think, one of the most common. Very common. So if someone having an ulcer which is non-healing, it's a high time to consult a doctor. Another myth is like my sugar is only borderline. This borderline will not die. This is what people are thinking. But still, I will say, if something is deep into the sugar, if your organ is deep into the sugar, it's going
to be very easy for the layman to understand. And then, George, that is an important point that he mentioned. Borderline. So what is a borderline? It's not between two countries that we have bordered. In diabetes, if you look at it, the pre-diabetes spectrum is huge. From HbA1c 5.7 to 6.4. So this is the point where we'll talk about HbA1c. Because we're talking about, is it just sugar? So if somebody is going to look for just sugar, we will not reach diabetes. We need to look for HbA1c, which is the average sugar of the last 4 months. Now, when we are looking at that value, the patient is able to confirm whether he is normal or pre-diabetic or diabetic. So maybe in this session, let us make sure to people that there is nothing called border. Okay, you are either normal or pre-diabetic or diabetic. So if you're pre-diabetic, you have a chance for becoming diabetes. So this is the time where you should act. Now you should understand that if you are scared about diabetes, well, this is the area where you should be tackling yourself so that you do not progress to diabetes. George, is that happening, that patients have a scare about diabetes?
Yeah, especially in today's world, like I mentioned, with all these online gadgets and everything, people are often misled on the fact about diabetes, So they feel that unless the sugar goes to very high levels, nothing can happen to that. But this is actually false, because we have to keep acting. We should actually schedule visits to your doctor, and all this depends on your risk factors. So coming to the risk factors, there might be a role of genetics in this, especially type 1 diabetes. Then secondly, we might be discussing this further on in the talk. The current lifestyle, the patterns that we follow, too much of sitting, not much exercise, lack of sleep, increased stress at work, all these can contribute. So we have to identify the individuals who are at risk of these sort of the factors. And depending on that, we'll have to shortlist them. We will have to divide them into which category they fall into, and we'll have to act accordingly.